Okay, so now we're going to talk about medications used in labor and delivery. Before you receive any medication in labor and delivery, you're going to ask yourself 3 questions. Number 1, how will it affect my baby? Number 2, how will it affect me? And number 3, how will it affect my labor and the progression of my labor? So those are the 3 questions you're going to ask your provider and kind of ask yourself, is this worth it? Is this what I want right now? So how do we use medications in labor and delivery? We use medications for a lot of different reasons. We've already talked about for induction of labor. We've talked about the Sedatives suppository or the Sedatives medication or the Pitocin that they put in your IV to give you contractions. Also, if for some reason you go into preterm labor, they can give you medications to slow down preterm labor. For fighting infection, if mom should start running a fever, or for women who are group B strep positive, we call that GBS positive. That's about 50% of the population. GBS is a normal bacteria that lives in the genitourinary tract of about 50% of the population. It's not a sexually transmitted disease. It is simply a bacteria. But when that is transmitted to a baby, it can be life-threatening for the baby. So if we test mom before delivery, which usually that testing is around 36 weeks, if mom is GBS positive, then mom is automatically started on antibiotics via IV every 4 hours during her labor. That way, that titer of medication is at its highest point and it transmits to the baby. So that is IV antibiotics for mom, and that's used in labor as well. And then finally, probably what you're waiting to hear, is that we also use medications for pain relief in labor. So how do we use these medications? And I have a chart here that has a lot of the different medications and how they're used, their side effects, and what to watch for. So I'm going to start with sedatives. Sedatives are used, it's typically a sleeping pill. That's a sedative. Ambien. This is used a lot of times for women who have repetitive false labor. If there's a lot of false labor, mom's not getting any sleep, it's not dilating the cervix, the baby is fine, the mom is fine, she just needs some sleep, then sometimes an Ambien will be given for that. So what are the side effects? Number 1, sedatives have a long duration in the body. Well, that's a good thing in that it stays in your system and gives you a long night's sleep, right? But the bad news is if it gives you a long duration, it also stays in the baby's system for a long time, like up to 48 hours. So the baby's heart rate typically is a little bit less reactive during that time. And if baby happens to be born after you've taken an Ambien, if you do kick into true labor, then the baby may be a little bit sleepy, a little bit slower to nurse, and that kind of thing if they're born with a lot of that sedative in their body. But typically it's used very safely and very well. But that's just so you know. So what would alternatives be? If you're having a hard time sleeping, if you have a lot of false labor, remember what we talked about. Drink fluids, eat some food, warm baths, a warm shower, relaxation techniques, a good massage. So get that support person involved. Get a good massage and see if that will relax you into sleep. The second category is tranquilizers. The one that's most typically used is Phenergan. You may have heard of that. That helps with nausea, but it also helps as a relaxer. The time this is typically used, it's used in either IV or in an intramuscular injection. It can be given by mouth. It's used in active labor. It's used for nausea. It's also used just to take the edge off your anxiety or pain. The side effect for this in the baby is going to be a decreased heart rate and decreased respiratory rate. The good news is that it will wear off fairly quickly. within about 3 to 4 hours. So it gives mom a break from intense labor, but it also, remember, does decrease the baby's heart rate and respiratory rate. Do remember with this that a smart thing to do, if you've never had Finnegan, you don't know what that effect is, you can always ask to be given half the dose. See how it works in the body. If half the dose is all you need, then you take less. If half the dose is not enough, then they can turn around and give you the second half of the dose within the hour. Okay, so that's just an option for you. The next category is narcotic. The one most typically used in labor and delivery is fentanyl. It has the effect of decreasing your sensation of pain. It doesn't take pain away. What it does is it changes the way you think about pain. So you just don't care about that pain quite as much. But that's what it will do for you. It has a very short lifespan in the body. So it works for about 2 hours. The good news is it doesn't stay in the baby's system very long. So it's a very short-acting medication. And people use it just to get over the hump. Remember we talked about transition in labor is the shortest phase, 30 minutes to an hour. So sometimes people will use this to get through. If they've had no medication and they don't want an epidural, they use the fentanyl to get through that last push. The other reason they might use it is if they're only 2 centimeters and they really want to get an epidural, but they don't want to get it that early in labor, then they may use fentanyl to tide them over until they're 3 to 4 centimeters and then get the epidural. So all of those options. Remember, other options here instead of using fentanyl are the breathing techniques that we talked about, the relaxation techniques, letting go and letting your body do what it's supposed to do. Those are all options. Position changes. If you're laboring in a place that has a tub, a water birth, that would be an option, is getting in the tub. Now, most facilities that have a tub for water birth options require that you take a water birth class before. So make sure you do that in advance. If you are at home, you can get in a nice warm shower as an option. And then finally, I'm going to talk about regional anesthesia. And what you've most often heard about is an epidural. The epidural is the most common method of pain relief in labor and delivery. And the reason for that is that the epidural is an injection into the back. It's administered by an anesthesiologist. When the medication goes in, it goes into the epidural space, which is just outside the spinal column. And it's a numbing agent. It provides numbing from the waist down. Once that injection goes in, they put a tiny little tube through that needle and into the back, and then the needle comes out, so that all that stays in is a tiny little flexible tube that is hooked up to a pump, like an IV pump, so that they can continually administer medication into that epidural space. And it gives you numb and tingly from the waist down. The benefit to an epidural is that it doesn't go into the mother's bloodstream. So it doesn't have the effects on the baby of the decreased heart rate, decreased respiratory rate that we've seen with the other medications that get into mom's bloodstream. And that's why an epidural is used so often in labor and delivery. So that being said, what are the risk factors with an epidural? After the epidural is administered, mom is encouraged to lay on her back for a period of time so that the medication disperses evenly throughout the body. When mom lays on her back, it puts pressure on the blood vessels, and sometimes the baby's heart rate does slow down, and sometimes mom's blood pressure drops after the epidural. So that's why you must have an IV. You must have IV fluids, a full liter of fluids right before you get this epidural. Some people have the mistaken idea that they're going to walk into the hospital and say, I want an epidural, and presto, you get an epidural. It doesn't happen that way. When you get to the hospital, they have to do monitoring for 30 full minutes. They have to do your labs. They draw blood and send it to the lab. They have to wait for the lab results to come back, and they have to start an IV and give you a full liter of IV fluids before you can get an epidural. So understand that the breathing and relaxation techniques, the understanding of the other medication options that you have, you need to have a grasp of that, because you may have a delay in getting your epidural. So I like everybody to understand that it's not just, I walk in, I want an epidural, I get it, bam, I'm great. Learn these other techniques and learn these other medications so that you have tools in your toolbox to use for coping with labor. Okay? So that's the epidural. I do like to make sure that everybody understands with an epidural, you will also have a urinary catheter in the bladder. All of that will be removed as soon as the baby is delivered. So if you do not have an epidural and you find that you need a C-section, then as long as it's not an emergency C-section, they will administer what we call a CSE, combined spinal epidural. And for this procedure, it's administered the same exact way that an epidural is administered, but for this, they will inject medication into the spinal column. That lasts just about 1 to 2 hours, just enough time for the C-section itself, so it's a much more profound numbing. And then they will inject also into the epidural space so that you have the pain relief from the epidural space, and they can put a pain relieving medication that stays in your system for the first 12 hours after your C-section and gives you good pain relief for the first 12 hours after the C-section as well. So it's called a combined spinal epidural, and that's another method of pain relief specific to the C-section. One last thing that I didn't mention, but if you have an emergency C-section and you don't have an epidural in place already, then you would be given general anesthesia, and that is when they put you to sleep, like a typical surgery. This has a more profound effect, kind of gives you a hangover effect for a couple of days after surgery. You may have a sore throat because they do have to put a tube down to breathe for you, so if you have a sore, scratchy throat afterwards. And you just may be drowsy for 6-7 hours after surgery. So support person will really rely on you to be there, to help with nursing, to help mom with getting up and moving around. Really encourage you to get up and move within about 6 hours after surgery. You need to be moving. The sooner you move, the faster you heal. Okay, so that in a nutshell is medications for labor and delivery. Do remember that you are getting to embark on an amazing journey. It's a miracle, and you get to be the center, on the center stage of this miracle. So I pray that you all enjoy the journey as you go through this. Thanks. Enjoyed it.